The morning sun cast long shadows across the Fort Campbell training facility as Natalie Rodriguez adjusted her gear one final time. At 28, she carried herself with a quiet confidence that most people mistook for timidity. Her slight build and gentle features had earned her more than her share of skeptical glances throughout her military career, but today felt different. Today, she was starting fresh at the Army's elite combat medical training school, where precision under pressure separated the qualified from the hopeless. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed because tomorrow I've saved something extra special for you. The irony wasn't lost on her that after everything she'd been through, she was once again having to prove herself to a room full of strangers who saw only what they expected to see. Another soft-spoken woman trying to make it in a world built for harder people. Listen up, candidates. Staff Sergeant Marcus Thompson's voice cut through the morning air like a blade. His weathered face showed the kind of experience that came from years of separating the wheat from the chaff. What you're about to undertake isn't just training. It's a complete transformation of how you think, how you react, and how you save lives when everyone else is losing theirs. Natalie stood in formation with 43 other soldiers, each one hand-picked for this intensive program. The Combat Medical Training School wasn't just about learning to patch wounds and start IVs. It was about becoming the kind of medic who could perform life-saving procedures while bullets flew overhead, who could make split-second decisions that meant the difference between a soldier going home to their family or going home in a flag-draped box. The selection process had been brutal. Physical fitness tests, psychological evaluations, interviews with senior medical personnel, and practical examinations that pushed candidates to their absolute limits. Out of nearly 300 applicants, these 44 had made the cut. But as Sergeant Thompson was fond of reminding them, making it to the starting line and crossing the finish line were entirely different achievements. Look around you, Thompson continued, his eyes scanning the assembled group. Statistically speaking, half of you won't complete this program. Of those who do complete it, only about 60% will actually deploy with a combat unit. The rest will find themselves reassigned to nice, safe medical facilities where the biggest emergency they'll face is a case of food poisoning from the mess hall. A few nervous chuckles rippled through the formation, but Natalie remained silent. She'd heard variations of this speech before, in different contexts, with different stakes. The words changed, but the underlying message was always the same. Prove you belong, or get out of the way for someone who does. She glanced sideways at her fellow candidates. Most were young, fresh-faced soldiers who looked like they'd stepped out of a recruiting poster. There was Jake Morrison, a former college football player whose shoulders seemed too wide for his uniform. Next to him stood Amanda Chun, a registered nurse from California who'd given up a lucrative civilian career to serve her country. Behind them, she could see David Williams, a soft-spoken soldier from Georgia whose gentle demeanor masked an intensity that became apparent whenever medical procedures were discussed. Then there were the others, the ones who looked at Natalie with barely concealed skepticism. Private First Class Kyle Henderson had made no secret of his opinion that women, particularly small women, had no place in combat medicine. He'd been heard saying that when lives were on the line, you needed someone who could carry a wounded soldier to safety, not someone who looked like she might need carrying herself. Sergeant Thompson moved to the center of the formation, his presence commanding immediate attention. Your first exercise begins now. You see those medical stations set up across the field. Each station represents a different emergency scenario you might encounter in a combat zone. Traumatic amputation, sucking chest wound, arterial bleeding, airway obstruction, all the greatest hits that keep combat medics awake at night. Natalie's heart rate increased slightly, but not from nervousness. This was familiar territory, even if the specific scenarios were new. She'd learned long ago that the key to success in high-pressure Medical situations wasn't just technical knowledge. It was the ability to maintain calm focus while chaos erupted around you. You'll rotate through each station in teams of 4. Thompson continued. Your performance will be evaluated not just on technical proficiency, but on leadership, communication, and ability to function under stress. Because in the real world, perfect technique means nothing if you can't execute it when someone's life depends on your steady hands. The candidates were divided into groups, and Natalie found herself assigned to a team with Kyle Henderson, Amanda Chun, and a quiet soldier named Robert Walsh from Michigan. Kyle's expression when he saw the team composition left little doubt about his feelings on the matter. "Great," he muttered under his breath, just loud enough for Natalie to hear. "Hope we don't get anything too challenging for our first round." Amanda Chun shot him a sharp look, but Natalie simply checked her medical kit and waited for instructions. She'd learned that responding to provocations like Kyle's usually made situations worse, not better. Better to let her actions speak for themselves. Their first station simulated a battlefield triage scenario. Multiple casualties, limited resources, and a ticking clock that represented the window of opportunity before reinforcements could arrive. The instructor, a grizzled master sergeant named Rodriguez, no relation, despite the shared surname, laid out the scene with clinical precision. You've got 4 casualties. Soldier 1 has a penetrating abdominal wound with signs of internal bleeding. Soldier 2 has a compound fracture of the femur with arterial involvement. Soldier 3 is unconscious with head trauma and compromised airway. Soldier 4 has severe burns over 30% of his body. You have limited supplies and approximately 15 minutes before medical evacuation arrives. Your decisions determine who lives and who dies. Begin. The scenario was designed to be overwhelming, and it succeeded. Kyle immediately moved toward the burn victim, declaring it the most obvious priority. Amanda headed for the head trauma case, her nursing background drawing her toward the airway. Management challenge. Robert Walsh seemed frozen by the complexity of the choices. Natalie surveyed the scene for exactly 3 seconds, before moving with decisive purpose toward Soldier 2, the compound fracture with arterial bleeding. Her hands moved with practiced efficiency as she applied direct pressure to the bleeding site, while simultaneously assessing the other casualties. "Robert, I need you on Soldier 3, she called out, her voice calm but authoritative. "Airway first, then check pupils and responsiveness. Amanda, after you stabilize that airway, I need you to assess the abdominal wound for signs of shock." Kyle looked up from the burn victim, irritation flashing across his face. "Who made you team leader?" "I think I can handle coordinating. The arterial bleed is going to kill him in under 5 minutes, Natalie interrupted, not looking away from her patient. "The burn victim is stable for now, but Soldier 1 needs immediate pressure on that abdominal wound to prevent him from bleeding out internally." Her hands worked as she spoke, applying a tourniquet with the kind of smooth efficiency that spoke of extensive practice. The simulated blood flow stopped immediately, and she moved on to stabilizing the fracture while continuing to direct the team's efforts. "Master." Sergeant Rodriguez watched with interest as Natalie orchestrated the response. Her technique was flawless, but more importantly, her situational awareness and leadership under pressure were exceptional. She'd correctly identified the most immediate threats to life and had organized her team to address multiple critical issues simultaneously. Kyle, meanwhile, was struggling with the burn victim. His movements were technically correct but hesitant, and he kept glancing over at Natalie's work with obvious frustration. It was clear that he'd expected to take charge of the team, and having a small woman issue orders that actually made sense was not sitting well with his preconceptions. "Time," Rodriguez called out after exactly 15 minutes. The team stepped back from their patients, and Rodriguez began his assessment. He moved from casualty to casualty, checking their work with the practiced eye of someone who'd seen real combat medicine. When he reached Natalie's patient, he paused for a long moment, examining the tourniquet placement and fracture stabilization. "Textbook," he said finally. "Clean tourniquet application, proper fracture immobilization, and you managed to coordinate. Care for all 4 casualties without losing sight of the priorities." He turned to address the entire team. Rodriguez here demonstrated what we call battlefield leadership. She didn't wait for someone to tell her what to do. She assessed the situation, made decisions, and got results. "Henderson, your burn care was adequate, but you spent too much time second-guessing yourself and not enough time helping coordinate overall care." Kyle's jaw tightened, but he said nothing. Amanda Chun nodded appreciatively at Natalie, recognizing competence when she saw it. Robert Walsh looked relieved that someone had taken charge and guided him through the scenario. As they moved to the next station, Kyle fell into step beside Natalie. "So where'd you learn to do that? Previous medical training?" There was something in his tone that suggested he was fishing for an explanation that would make sense of what he'd just witnessed. In his worldview, someone like Natalie shouldn't have been able to outperform him so decisively, so there had to be some outside factor that explained it. "Just paying attention and training," Natalie replied simply. It wasn't technically a lie, but it wasn't the whole truth either. The whole truth was complicated, and she'd learned that explaining her background often created more problems than it solved. Better to let people draw their own conclusions and focus on the work at hand. The second station focused on trauma surgery techniques under combat conditions. Each candidate was required to perform a simulated emergency thoracotomy, essentially cracking open a chest cavity to repair cardiac damage when conventional methods weren't sufficient. It was an advanced procedure that most medics would never perform outside of training, but in extreme combat situations, it could be the difference between life and death. The instructor, Captain Jennifer Walsh, demonstrated the procedure with clinical precision. Her hands moved with the kind of fluid motion that came from years of practice, and she talked through each step with the clarity of someone who'd had to teach these techniques under less than ideal circumstances. "The key to emergency thoracotomy isn't just knowing where to cut," she explained. "It's understanding when to cut. This procedure has a very narrow window of effectiveness, and if you attempt it at the wrong time or under the wrong circumstances, you're likely to do more harm than good." When it came time for individual performance, the candidates lined up to take their turns. Jake Morrison went first, his large hands surprisingly gentle as he worked through the procedure. His technique was solid, though he took longer than ideal to make his initial incision. Amanda Chun followed with nurse-like precision, her movements economical and purposeful. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. Kyle's turn was competent, but unremarkable. He made all the right moves, but seemed to be thinking through each step rather than flowing naturally from one action to the next. When Captain Walsh asked him to explain his decision-making process, his answers were textbook correct, but lacked the kind of intuitive understanding that separated good medics from great ones. Then it was Natalie's turn. She approached the training mannequin with the same calm focus she'd shown at the triage station. Her hands moved with startling confidence as she palpated for landmarks, and when she made her initial incision, it was with the kind of decisive precision that spoke of someone who'd done this before, not just in training, but when it actually mattered. Captain Walsh watched with growing interest as Natalie worked through the procedure. Her technique wasn't just correct, it was elegant. Every movement served a purpose, and she completed the entire sequence in roughly half the time it had taken the other candidates, all while maintaining perfect form. "Explain your approach," Captain Walsh said when Natalie finished. "The key indicators for emergency thoracotomy are penetrating chest trauma with cardiac arrest, or severe shock that doesn't respond to fluid resuscitation," Natalie replied. The procedure has the highest success rate when performed within 15 minutes of injury, and the primary goal is to identify and repair cardiac damage, relieve pericardial tamponade, or control major vessel bleeding. She paused, her hands still steady as she demonstrated proper closure technique. In a combat environment, you're also looking for signs that conventional treatment isn't working. Dropping blood pressure despite adequate IV access, absent pulse with organized cardiac rhythm on the monitor, signs of tension pneumothorax that don't respond to needle decompression. Captain Walsh nodded slowly. The textbook knowledge was impressive, but what really caught her attention was the way Natalie discussed the procedure. She wasn't reciting memorized information. She was sharing practical understanding that came from somewhere deeper than classroom instruction. "Have you performed this procedure before?" Walsh asked directly. "Only in training environments," Natalie replied, which was true in the strictest technical sense, but something in her tone made Captain Walsh take a closer look. There was a confidence in Natalie's movements, a familiarity with high-pressure medical procedures that seemed to go beyond what her personnel file suggested. Most soldiers with her apparent background would show at least some hesitation when performing advanced procedures for the first time. But Natalie had approached the thoracotomy like she'd done it dozens of times before. The third station of the day focused on combat, casualty evacuation under fire. It was a physical challenge as much as a medical one. Candidates had to provide medical care to simulated casualties while navigating obstacles designed to represent a hostile environment. Smoke machines created visibility problems, speakers blared the sounds of gunfire and explosions, and instructors periodically shouted commands that forced candidates to take cover while maintaining care for their patients. This was where many expected Natalie to struggle. The physical demands of the exercise seemed designed for larger, stronger soldiers who could easily carry wounded personnel while maintaining medical care. Kyle, in particular, seemed confident that this would be where reality caught up with what he saw as Natalie's artificially inflated performance. But once again, Natalie surprised everyone. Rather than trying to match the brute force approach that some of the male candidates employed, she used leverage and technique to move casualties efficiently. More importantly, she never lost sight of the medical priorities. Even when the simulated combat environment was at its most chaotic, while other candidates were distracted by the noise and confusion, she maintained focus on her patient's conditions and continued providing appropriate care. When Kyle attempted to carry a simulated casualty over his shoulder while administering 4 fluids, he quickly found himself struggling with the logistics. The 4 line became tangled, his movement was awkward, and he ultimately had to stop and restart his medical procedures twice. Natalie, meanwhile, had improvised a drag technique that allowed her to move her casualty to safety while maintaining continuous medical care. She'd positioned the 4 bag in a way that prevented line tangles, and her smaller size actually proved advantageous when navigating some of the tighter obstacles in the course. By the end of the first day, it was clear that Natalie wasn't just keeping up with the other candidates, she was setting the standard. Her technical knowledge was exceptional, her practical skills were flawless, and her ability to maintain performance under stress was remarkable. But rather than earning respect from her peers, her success seemed to be generating resentment, particularly from candidates like Kyle, who'd expected to dominate the program. As the candidates gathered their gear at the end of the day, Kyle made a point of walking over to Natalie. His expression was friendly enough, but there was something calculating in his eyes. "Pretty impressive first day," he said. "You've obviously put a lot of preparation into this." "Thank you," Natalie replied simply, not taking the bait to elaborate. "I'm just curious, what made you decide to go for combat medicine? I mean, with your background, you could probably have your pick of safer assignments." It was a fishing expedition, pure and simple. Kyle was trying to figure out what he was dealing with, and his tone suggested he wasn't entirely comfortable with what he'd observed. In his experience, people who performed at Natalie's level usually had backgrounds that explained their competence, and he was clearly puzzled by the disconnect between her apparent experience and her official record. "Just seemed like the right fit," Natalie said. Shouldering her packed out as she walked away, Kyle exchanged glances with a few of the other candidates. It was clear that questions were being asked and assumptions were being challenged. But for Natalie, the day had gone exactly as she'd expected. She'd done her job, performed to the best of her ability, and avoided drawing unnecessary attention to her background. What none of her fellow candidates knew, what none of them could have known, was that everything they'd witnessed was just the tip of the iceberg. Natalie's calm under pressure, her flawless technique, and her intuitive understanding of combat medicine weren't the result of exceptional preparation for this training program. They were the result of something else entirely, something that would remain hidden beneath the surface until circumstances forced it into the light, something that would change how everyone saw her and how they understood what they were really dealing with. But for now, as the first day of training came to an end, Natalie Rodriguez was content to be underestimated. She'd learned long ago that there were advantages to being invisible, to letting people see only what they expected to see. The truth, when it finally came out, would be far more complicated than anyone imagined. 3 days into the program, the initial shock of Natalie's performance had settled into a more complex dynamic among the candidates. The training facility buzzed with speculation during mealtimes and evening downtime, as soldiers tried to reconcile what they'd witnessed with what they thought they knew about their quiet teammate. The mess hall conversations revealed the depth of assumptions that had taken root. Private Martinez from Texas was convinced Natalie must have civilian medical experience that wasn't reflected in her file. Maybe she was an EMT before enlisting, he suggested to his tablemates. That would explain the steady hands and the quick thinking. Specialist Thompson from Ohio had a different theory. "I bet she's one of those overachievers who studied every manual twice before getting here. You know the type, compensates for physical limitations with excessive preparation." His words carried the subtle dismissiveness of someone who believed natural ability trumped hard work every time. But it was Kyle Henderson who voiced what many were thinking during a particularly pointed exchange in the barracks. "Look, I'm not saying she's not smart or that she hasn't memorized the procedures. But there's a difference between performing well in controlled training scenarios and handling real-world combat medicine. When bullets are flying and your patient is screaming, technique only gets you so far." His roommate, Jake Morrison, nodded thoughtfully. "She's definitely got the knowledge down, but combat medicine isn't just about knowing what to do. It's about having the physical presence to command respect from wounded soldiers who might outweigh you by 80 pounds and outrank you by 3 pay grades." These conversations happened just out of Natalie's earshot, but their tone and content weren't exactly secret. The underlying message was clear. Her performance so far was impressive, but ultimately irrelevant to the real challenges ahead. In their view, she was succeeding in the easy part of training, where controlled conditions and simulated patience created an artificial environment that favored academic achievement over practical capability. The instructors, meanwhile, were having their own discussions about the unusual candidate who was quietly dominating every aspect of the program. Captain Walsh had reviewed Natalie's personnel file 3 times, looking for something that would explain her exceptional performance. What she found was unremarkable: basic training at Fort Leonard Wood, advanced individual training in medical operations, 2 years of routine assignments at stateside medical facilities. Nothing that would suggest the level of competence she was demonstrating. "It's possible she's just naturally gifted," Master Sergeant Rodriguez suggested during a staff meeting. "Some people have an intuitive understanding of medical procedures that goes beyond training." Captain Walsh wasn't entirely convinced. Natural talent doesn't explain the kind of situational awareness she showed during the evacuation exercise. The way she coordinated care while managing tactical movement that comes from experience, not instinct, but without evidence of undisclosed background or training, they had little choice but to accept Natalie's performance at face value. Her official record was clean, her references were positive but unremarkable, and her psychological evaluations indicated someone who was competent, but not exceptional. On paper, she was exactly what she appeared to be, a dedicated soldier with solid medical training who was performing well in an advanced program. The fourth day of training introduced battlefield triage decisions under mass casualty conditions. The scenario was brutal in its simplicity: too many wounded, too few resources, and decisions that would determine who lived and who died. It was designed to test not just medical knowledge, but psychological resilience and moral decision-making under impossible circumstances. 20 simulated casualties were spread across a mock battlefield, each representing different degrees of injury severity. The candidates were divided into teams of 4 and given limited medical supplies. Their job was to assess, prioritize, and treat as many patients as possible within a 30-minute window, knowing that some would inevitably be left to die. Natalie found herself teamed with Amanda Chun, David Williams, and a new candidate named Sarah Peterson from Oregon. Sarah was a former college pre-med student who'd enlisted after graduation, and she approached the exercise with the kind of analytical mindset that academic success had taught her to value. "We should start by conducting a systematic assessment of all casualties," Sarah suggested as they surveyed the scene. "Establish a clear triage protocol and then allocate resources based on survivability indices." It was a textbook approach that would have earned high marks in a classroom setting. But as Natalie looked across the simulated battlefield, she saw something that Sarah's academic training hadn't prepared her for: the reality that perfect systems collapsed under the pressure of imperfect circumstances. "We don't have time for systematic assessment," Natalie said quietly. "By the time we finish evaluating everyone, the ones we could have saved will be beyond help." She moved quickly toward a cluster of casualties near the center of the field, her eyes scanning each patient with practiced efficiency. Within seconds, she'd identified the salvageable cases and begun organizing treatment priorities. "Amanda, I need you on the chest wound by the concrete barrier. He's got a tension pneumothorax, but his vitals are still stable. David, take the femoral artery bleed near the truck, direct pressure and fluid replacement. Sarah, help me with the abdominal trauma here, but we're going to have to work simultaneously on multiple patients." Sarah hesitated. "Shouldn't we follow established triage protocols? This seems like we're making arbitrary decisions without proper assessment." Natalie paused in her work long enough to look directly at Sarah. "In a perfect world, yes, but this isn't a perfect world. That patient over there with head trauma and fixed, dilated pupils, the textbook says we should attempt resuscitation. Reality says he's already gone, and the 10 minutes we'd spend trying to save him could be used to save 2 other people who actually have a chance." It was a harsh lesson in battlefield pragmatism that highlighted the difference between academic medicine and combat medicine. Sarah's medical knowledge was solid, but she'd been trained to save everyone. Natalie understood that sometimes saving everyone meant letting someone die. The exercise progressed with brutal efficiency under Natalie's informal leadership. She moved between patients with a fluidity that seemed almost choreographed, spending exactly as much time as each case required, and no more. When Amanda struggled with a difficult airway, Natalie provided guidance without taking over. When David needed additional supplies, she'd somehow already positioned them within reach, but it was her decision-making that really set her apart. While other teams agonized over borderline cases, spending precious minutes on patients who might or might not survive, Natalie made quick, decisive calls that maximized the number of lives saved. She wasn't callous about it. There was genuine regret in her eyes. When she tagged someone as an expectant, But she didn't let emotional considerations override tactical necessity. When the 30-minute timer expired, Master Sergeant Rodriguez moved through the exercise area to assess each team's performance. He checked vital signs on the simulated patients, reviewed treatment decisions, and tallied survival rates based on established medical criteria. Natalie's team had achieved something remarkable. They'd saved 17 of the 20 casualties, with 2 additional patients stabilized enough for higher-level care. No other team had saved more than 12, and most had managed only 8 or 9 successful treatments. Rodriguez, Master Sergeant Rodriguez called out, using her last name in military fashion. Explain your triage decisions. Natalie walked him through her reasoning, patient by patient. Her explanations were clinical and precise, but what struck Rodriguez was the depth of her understanding about resource allocation under extreme constraints. She didn't just know how to treat medical conditions. She understood the mathematics of battlefield medicine in a way that most medics took years to develop. The abdominal wound with signs of internal bleeding, you tagged him as immediate priority despite the severity of his injuries, Rodriguez noted. Explain that decision. Penetrating abdominal trauma with controlled bleeding responds well to surgical intervention if treated quickly, Natalie replied. His vital signs indicated early shock but not irreversible shock. With rapid fluid resuscitation and proper surgical care, his survival probability was greater than 70%. Rodriguez nodded. And the head trauma case you tagged as expectant? Fixed and dilated pupils, Glasgow Coma Scale of 3, obvious brain matter visible through the wound. Even with immediate neurosurgical intervention, survival probability was less than 5%, and meaningful recovery was essentially 0. The resources required to attempt treatment would have prevented us from saving multiple other patients with better prognoses. The clinical detachment in her voice was striking. Most candidates, even experienced ones, showed some emotional reaction when discussing decisions to let patients die. Natalie discussed it like a mathematical equation with the kind of professional distance that typically took years of combat experience to develop. Sarah Peterson, who had struggled throughout the exercise, looked disturbed by the conversation. How can you be so matter-of-fact about letting someone die? Don't we have an obligation to try to save everyone? Natalie considered the question seriously before answering. In a civilian emergency room with unlimited resources and backup available, yes. In a combat zone with limited supplies and no reinforcements coming, your obligation is to save as many as possible. Sometimes that means making choices that feel wrong but are mathematically correct. The philosophical difference was clear. Sarah approached medicine from the perspective of individual patient care, where every life was worth any effort to save. Natalie approached it from the perspective of population medicine, where success was measured by overall survival rates rather than individual outcomes. That afternoon's training focused on combat stress management, both for patients and for medical personnel. The instructors emphasized that combat medics often served as informal counselors for soldiers dealing with the psychological trauma of warfare, and that managing their own stress responses was crucial for maintaining effectiveness under pressure. Captain Walsh led this portion of the training, drawing on her own deployment experience to illustrate the psychological challenges that combat medics faced. You'll see things that civilian medical personnel never encounter, she explained. Young soldiers with injuries that would normally be fatal, trying to give you messages for their families. Friends and teammates who are wounded beyond your ability to help. Command decisions that put lives at risk for strategic objectives. She paused to make eye contact with each candidate. The technical skills we're teaching you will keep your patients alive. But managing the psychological impact of combat medicine is what will keep you functional and allow you to continue serving effectively. The candidates were divided into small groups to discuss scenarios involving moral injury and combat stress. Each group was given a different situation to analyze, a medic who had to choose between treating a wounded enemy combatant or an injured teammate. A situation where following medical protocols conflicted with tactical objectives. A case where a medic's decisions resulted in preventable deaths. Natalie found herself in a group with Kyle Henderson, Jake Morrison, and Amanda Chen. Their assigned scenario involved a medic who had been forced to leave a wounded soldier behind during a tactical withdrawal. Knowing that the soldier would likely die without immediate medical care, Kyle immediately took charge of the discussion. Obviously, the medic made the wrong choice. You never leave a wounded soldier behind, period. That's fundamental to military ethics. Jake nodded in agreement. I don't care what the tactical situation was. Find a way to bring him with you, or stay behind and treat him. That's what we sign up for when we become medics. Amanda was more thoughtful in her response. I understand the principle, but what if staying behind meant that multiple other people would die? What if the tactical situation made rescue impossible? Then you stay and die with your patient, Kyle said firmly. That's the commitment we make. You don't abandon wounded soldiers for tactical convenience. The group turned to Natalie, who had remained silent throughout the exchange. Her expression was carefully neutral, but there was something in her eyes that suggested the scenario resonated with her, in a way that the others couldn't quite understand. It's an impossible situation, she said finally. In a perfect world, you never leave anyone behind. But combat situations aren't perfect, and sometimes impossible choices have to be made. Kyle frowned. That sounds like you're justifying abandoning wounded soldiers. I'm acknowledging that sometimes the choice isn't between right and wrong. It's between two different kinds of wrong, and you have to choose the option that results in the least overall harm. Natalie's voice remained calm, but there was an undertone that suggested she was speaking from something deeper than theoretical knowledge. How can you say that leaving a wounded soldier to die results in less harm? Jake asked. Natalie was quiet for a long moment before responding. Because sometimes the alternative is losing everyone. Sometimes the choice is between saving 3 people or losing 4 people. And basic mathematics dictates the decision, even when it feels morally wrong. The conversation continued, but it was clear that Natalie's perspective was fundamentally different from her teammates. While they approached the scenario as a theoretical exercise in military ethics, she seemed to be drawing on some deeper understanding of the weight of impossible decisions. Captain Walsh, who had been circulating between groups, paused near their discussion. She'd been observing Natalie carefully throughout the training program, and something about the soldiers' responses to stress scenarios was triggering her professional instincts. The way Natalie discussed combat medicine wasn't typical of someone whose experience was limited to stateside medical facilities. During the break, Captain Walsh approached Natalie privately. Rodriguez, can I speak with you for a moment? They walked to a quiet area away from the other candidates. Captain Walsh studied Natalie's face carefully before speaking. Your responses to the stress scenarios today were unusual. Most candidates approach these situations as theoretical exercises. You seem to be drawing on practical experience. Natalie's expression remained neutral. I try to think through scenarios realistically, ma'am. I've reviewed your personnel file, Walsh continued. Your assignments have been routine medical facilities. No combat deployments. But your understanding of battlefield medicine seems to go beyond what that experience would provide. There was a question implicit in the statement, an invitation for Natalie to elaborate on her background. But Natalie simply nodded and said, I've studied this subject extensively, ma'am. Captain Walsh wasn't entirely satisfied with the answer. But without specific evidence of undisclosed experience, she couldn't push further. Continue with your training, Rodriguez. You're performing exceptionally well. As Natalie walked back toward the group, she reflected on how many times she'd had similar conversations throughout her military career. People sensed that there was more to her story than her official record suggested, but without proof. They were left with questions and suspicions. The truth was both simpler and more complicated than anyone imagined. Natalie Rodriguez was exactly who her personnel file said she was, but she was also someone else entirely. Someone whose experiences had been classified at levels that didn't appear in standard military records. Someone whose background included things that couldn't be discussed in casual conversation or training exercises. The evening concluded with individual counseling sessions, where candidates met one-on-one with instructors to discuss their progress and address any concerns. When Natalie's turn came, she found herself sitting across from Master Sergeant Rodriguez in a small office adjacent to the training facility. "You're excelling in every aspect of the program," he began, reviewing notes from the day's exercises. "Your technical skills are outstanding. Your decision-making under pressure is exceptional, and your leadership abilities are well above average for someone at your experience level." Natalie listened quietly, unsure where the conversation was heading. "The thing is," Rodriguez continued, "excellence like yours usually comes from somewhere specific. Extensive civilian medical experience, prior military deployment, specialized training programs, something that explains the level of competence you're demonstrating." He leaned back in his chair, studying her face. "Your personnel file shows standard progression through routine assignments, but your performance suggests someone with significantly more experience than that would provide. I'm not accusing you of anything, but I am curious about the disconnect." It was the most direct anyone had been about questioning her background, and Natalie knew that her response would likely determine how the rest of her training experience proceeded. She could provide vague answers that deflected the question, or she could acknowledge that there were aspects of her experience that weren't reflected in her standard personnel file. "I've had opportunities to observe and learn from experienced medical personnel throughout my career," she said carefully. "Sometimes the most valuable training happens outside of formal programs." It was true as far as it went, but it was also incomplete in ways that Master Sergeant Rodriguez clearly recognized. His expression suggested that he understood he wasn't getting the full story, but he also seemed to accept that pushing further might not be productive. "Fair enough," he said finally. "Whatever your background, you're setting a high standard for the rest of the candidates. Keep up the excellent work." As Natalie left the office, she knew that questions about her background weren't going away. If anything, they were likely to intensify as her performance continued to exceed expectations. Eventually, someone would dig deeper, or circumstances would arise that forced the truth into the open. But for now, she was content to let people wonder. The assumptions and speculation said more about others' limitations than about her capabilities. And she'd learned long ago that managing perceptions was often as important as managing actual performance. The real test would come when the controlled environment of training gave way to the unpredictable chaos of actual combat situations. That's when the difference between textbook knowledge and practical experience would become impossible to hide. That's when the truth about Natalie Rodriguez would finally be revealed. By the second week of training, the initial novelty of Natalie's exceptional performance had transformed into something more complex and troubling. What had begun as surprised curiosity among her fellow candidates was gradually morphing into resentment, skepticism, and outright hostility from certain quarters. The combat medical training program was designed to be competitive, and Natalie's consistent excellence was making some of her peers look inadequate by comparison. The shift became apparent during the advanced trauma workshop, where candidates were required to perform complex surgical procedures under simulated combat conditions. The scenario involved multiple patients with life-threatening injuries arriving simultaneously at a forward operating base medical facility. Each candidate would serve as the primary surgeon for one patient while assisting with others, and their performance would be evaluated not just on individual success, but on their ability to function as part of a coordinated medical team. Kyle Henderson had been assigned to work alongside Natalie on a particularly challenging case, a simulated soldier with multiple gunshot wounds to the abdomen, chest, and extremities. The patient required immediate surgical intervention to control bleeding, repair organ damage, and stabilize vital signs. It was the kind of complex multi-system trauma that separated competent medics from exceptional ones. As they began the procedure, Kyle took the position of primary surgeon, with Natalie assigned as his assistant. It was a logical arrangement based on their respective sizes and strength. Kyle's larger hands and greater physical presence seemed better suited to the demanding surgical work. But within minutes, it became clear that logic didn't mean effective. Kyle's surgical technique was adequate but hesitant. He knew the procedures intellectually, but translating that knowledge into smooth, confident action under pressure proved challenging. When he encountered unexpected bleeding during the abdominal exploration, he paused to consult his mental notes, precious seconds ticking away while the patient's condition deteriorated. "Clamp the hepatic artery," Natalie said quietly, her voice steady despite the chaos around them. "The bleeding is coming from a liver laceration, and direct pressure isn't going to be sufficient." Kyle nodded and reached for the clamp, but his hand position was awkward, and he struggled to achieve proper visualization of the bleeding vessel. After 30 seconds of unsuccessful attempts, sweat was beading on his forehead, and his movements were becoming increasingly erratic. "Let me assist," Natalie offered, moving to a better position to provide retraction and exposure. But instead of improving the situation, Kyle's frustration seemed to intensify. He was acutely aware that other candidates and instructors were observing their work, and having his smaller female assistant essentially take over was not the image he wanted to project. "I've got it under control," he said through gritted teeth, waving her away. The problem was that he clearly didn't have it under control. The bleeding continued, the patient's simulated vital signs were declining, and Kyle's attempts to achieve hemostasis were becoming increasingly desperate. What should have been a manageable surgical challenge was turning into a potential disaster, and everyone in the room could see it happening. Captain Jennifer Walsh, who was overseeing the exercise, watched with growing concern. In a real combat situation, this patient would be dying while the primary surgeon struggled with a procedure that should have been straightforward. She found herself in the difficult position of wanting to intervene, but knowing that learning to handle pressure was part of the training process. "Henderson," she called out, "what's your assessment of the situation?" Kyle looked up from his work, his face flushed with exertion and embarrassment. "Attempting to control hepatic bleeding, ma'am. The patient is stable but requires continued surgical intervention." It was technically accurate, but missed the broader picture entirely. The patient wasn't stable, the simulated monitors were showing progressive deterioration, and Kyle's surgical approach wasn't addressing the underlying problem effectively. Meanwhile, Natalie stood beside him, her expression carefully neutral, but her body language suggesting she was restraining herself from taking more decisive action. "Rodriguez," Captain Walsh said, "what's your assessment?" Natalie glanced at Kyle, clearly reluctant to undermine her teammate publicly. But medical accuracy ultimately trumped social considerations. "The patient is showing signs of hemorrhagic shock with continued intra-abdominal bleeding. Current surgical approach needs modification to achieve adequate hemostasis. Recommend repositioning for better vessel exposure and consideration of alternative clamping techniques." The diplomatic language couldn't disguise the fact that she was essentially saying Kyle's approach wasn't working and needed to be changed. Kyle's jaw tightened, and for a moment it looked like he might refuse to accept her recommendations. But with Captain Walsh watching and the patient's condition continuing to deteriorate, he had little choice. "Fine," he said curtly. "Show me what you're thinking." What happened next was a masterclass in surgical technique under pressure. Natalie moved with fluid precision, repositioning retractors to provide better exposure, identifying the exact source of bleeding that Kyle had been struggling to locate, and applying clamps with the kind of smooth efficiency that made complex procedures look effortless. Within 2 minutes, the bleeding was controlled, and the patient's vital signs began to stabilize. Kyle watched with a mixture of admiration and resentment as Natalie completed the repair work he'd been unable to handle. Her suturing technique was flawless, her tissue handling was gentle but decisive, and her overall surgical approach demonstrated a level of competence that clearly exceeded what her training record should have provided. "Good teamwork, Captain," Walsh commented when the exercise concluded. But her tone suggested she was well aware of who had actually saved the patient. The debrief session that followed was uncomfortable for everyone involved. Kyle's performance was critiqued in clinical terms that couldn't disguise the fact that he'd struggled with a procedure that should have been within his capabilities. Natalie's contributions were praised, but in a way that highlighted the contrast between her competence and Kyle's difficulties. "In combat medicine," Captain Walsh explained to the assembled candidates, "ego has no place in the operating room. If your teammate has a better approach or superior technique, you swallow your pride and let them work. The patient's life is more important than your personal feelings." The message was clear, but its impact on group dynamics was significant. Kyle left the session feeling humiliated and resentful, and his attitude toward Natalie shifted from skeptical curiosity to active hostility. Other candidates picked up on the tension, and battle lines began to form within the training group. That evening, the barracks conversations took on a more pointed tone. Kyle was no longer content to express private doubts about Natalie's background. He was actively campaigning to undermine her credibility among their peers. "There's something she's not telling us," he said to a group gathered around his bunk. "People don't perform at that level without significant prior experience. Either she's lying about her background, or she's getting some kind of special treatment that the rest of us aren't aware of." Jake Morrison, who had initially been supportive of Natalie, was beginning to have his own doubts. "I have to admit, it is pretty unusual. I mean, we're all supposed to be starting from roughly the same baseline, but she's performing like someone with years of combat experience." Sarah Peterson, still stinging from her own struggles with the triage exercises, nodded in agreement. "It's not fair to the rest of us if she has some kind of advantage that isn't being disclosed. We're being evaluated against an artificially high standard." The sentiment was spreading beyond Kyle's immediate circle. Other candidates were beginning to question whether Natalie's success was legitimate, and some were starting to treat her achievements with suspicion rather than respect. The collaborative atmosphere that had characterized the early days of training was being replaced by something more toxic. Amanda Chun, who had consistently defended Natalie, found herself increasingly isolated in her support. "You're all making assumptions based on jealousy," she said during one particularly heated barracks discussion. "Just because someone performs better than you doesn't mean they're cheating or hiding something." "Come on, Amanda," Kyle replied. "Be realistic. Nobody goes from routine medical assignments to performing like a seasoned combat surgeon without some explanation. Either she's got undisclosed training, or there's something in her background that we don't know about." The speculation was becoming increasingly elaborate and personal. Some candidates theorized that Natalie had civilian medical experience that wasn't reflected in her military record. Others suggested she might be related to senior military personnel who had provided her with special preparation. A few even whispered that she might be some kind of plant inserted into the program to evaluate the other candidates. What made the situation particularly frustrating for Natalie was that she couldn't directly address the accusations without revealing information that she wasn't authorized to disclose. Her actual background contained elements that would explain her exceptional performance, but those elements were classified at levels that made casual discussion impossible. The third week of training introduced combat medical operations in austere Environments, scenarios where candidates had to provide advanced medical care with minimal equipment, no backup support, and hostile conditions that simulated deep deployment situations. These exercises were designed to test not just medical knowledge but adaptability, resourcefulness, and the ability to improvise solutions when standard procedures weren't feasible. The first scenario placed candidates in pairs and dropped them into a simulated forward observation post that had come under attack. They were given basic medical supplies and told that evacuation wasn't possible for at least 6 hours. Their job was to keep multiple casualties alive using only what they could carry and whatever materials they could scavenge from the environment. Natalie was paired with David Williams, the quiet soldier from Georgia who had consistently performed well, but hadn't attracted the same level of attention or controversy that surrounded her. David approached the exercise with professional competence, but also with curiosity about working directly with someone whose abilities had become the subject of so much speculation. Their simulated patients included a soldier with a penetrating neck wound that had damaged major vessels, another with severe burns covering 40% of his body, and a third with multiple fractures and signs of internal bleeding. The combination of injuries was designed to be overwhelming. More than 2 medics could reasonably handle standard equipment and procedures, but Natalie immediately began adapting and improvising in ways that transformed the impossible scenario into a manageable challenge. She used materials scavenged from the mock environment to create improvised medical equipment. Plastic sheeting became sterile drapes, metal fragments were fashioned into retractors, and fabric strips were turned into pressure bandages and splinting materials. More impressively, she demonstrated techniques for advanced procedures that David had never seen before. When the neck wound patient began showing signs of airway compromise, she performed an emergency cricothyrotomy using a ballpoint pen and a razor blade, creating a functional airway in conditions where standard tracheostomy equipment wasn't available. "Where did you learn to do that?" David asked, watching in amazement as Natalie secured the improvised airway and restored the patient's breathing. "Field expedient techniques," Natalie replied simply. "Sometimes you have to work with what you have." But David could see that this wasn't just creative improvisation. It was the application of specialized knowledge that went far beyond what their training program had covered. The way Natalie modified standard procedures for austere conditions suggested someone who had actually performed medicine in environments where improvisation wasn't just helpful but necessary for survival. When they rotated to the burn victim, Natalie's approach was equally sophisticated. She created a fluid resuscitation protocol using improvised equipment and calculated burn percentages with the kind of precision that suggested extensive experience with thermal injuries. Her pain management techniques were advanced, and her overall approach to burn care demonstrated knowledge that typically required specialized training. David found himself in the position of assistant rather than equal partner, not because Natalie was dominating the scenario, but because her level of competence naturally drew leadership responsibilities to her. She gave clear, precise instructions and provided guidance that elevated his own performance. But the experience left him with profound questions about who he was really working with. The exercise concluded with both patients stabilized and their conditions significantly improved from the initial presentation. When Master Sergeant Rodriguez reviewed their work, his assessment was brief but telling. "Outstanding performance under extremely challenging conditions. Rodriguez, your field expedient techniques were particularly impressive. Where did you learn those approaches?" It was the same question David had asked, and Natalie's response was similarly nonspecific. "Various training opportunities throughout my career, Sergeant." But Rodriguez wasn't satisfied with the vague answer. He'd been in the military long enough to recognize the difference between improvised solutions and established techniques that had been adapted for field conditions. What Natalie had demonstrated wasn't creative problem-solving. It was the application of specialized knowledge that came from somewhere specific. The afternoon brought an even more challenging scenario, a mass casualty event in a chemically contaminated environment. Candidates had to provide medical care while wearing full protective equipment, managing multiple patients with both trauma injuries and chemical exposure symptoms. The exercise was designed to test their ability to function under the extreme stress of working in hazardous conditions while maintaining medical effectiveness. The scenario was intentionally overwhelming. 12 casualties with varying degrees of injury and contamination, limited decontamination equipment, and the constant threat that inadequate protective measures could result in contamination of the medical personnel. Most candidates approached the exercise with visible anxiety, knowing that mistakes could have serious consequences even in a training environment. Natalie, however, seemed to transform when she donned the protective equipment. Her movements became more efficient, her decision-making more rapid, and her overall approach more systematic. She established a decontamination protocol, organized triage procedures, and began coordinating care for multiple patients, simultaneously with the kind of fluid expertise that suggested extensive experience with hazardous environment operations. Kyle Henderson, who was working the same scenario, watched with growing frustration as Natalie took charge of the exercise. Her performance was making his own efforts look amateurish by comparison, and his resentment finally boiled over into direct confrontation. "Who put you in charge?" he demanded during a brief lull in the exercise. "This is supposed to be a collaborative effort, not a one-person show." Natalie looked at him through her protective mask, her voice muffled but calm. "I'm just trying to organize an effective response. If you have a better approach, I'm open to suggestions." "My suggestion is that you stop acting like you're running the show and let the rest of us contribute," Kyle replied, his voice carrying enough volume that other candidates and instructors could hear the exchange. The confrontation created an uncomfortable pause in the exercise, with other candidates unsure how to respond. Some clearly agreed with Kyle's frustration, while others recognized that Natalie's leadership was actually improving overall performance. But the tension was undeniable, and it was affecting the team dynamics of the entire scenario. Captain Walsh, who was observing the exercise, made a note of the interaction but didn't intervene immediately. Leadership conflicts were part of the training experience, and candidates needed to learn how to resolve them under pressure. But she was also aware that the underlying issues were more complex than simple personality conflicts. The exercise continued, but the atmosphere had changed. Kyle's public challenge had emboldened other candidates who harbored similar resentments, and Natalie found herself working in an increasingly hostile environment. Her instructions were questioned, her decisions were second-guessed, and her attempts to coordinate care were met with resistance rather than cooperation. Despite the interpersonal challenges, Natalie continued to perform at an exceptional level. She completed the decontamination procedures flawlessly, managed multiple critical patients simultaneously, and maintained full situational awareness throughout the complex scenario. But the cost was becoming apparent, the constant need to defend her actions and justify her decisions was taking an emotional toll that hadn't been visible in earlier exercises. When the exercise concluded, the debrief session was tense and uncomfortable. Captain Walsh addressed the performance issues directly, noting that while individual medical skills had been generally good, team coordination had broken down in ways that would have been catastrophic in a real combat situation. Medical care in combat environments requires seamless teamwork, she emphasized. Personal conflicts and ego disputes have no place when lives are on the line. If you can't work effectively with your teammates, you don't belong in combat medicine. The message was clear, but its impact on the growing divide within the training group was minimal. If anything, the public airing of the conflict seemed to encourage more open expression of the resentments that had been building over the previous weeks. That evening, The barracks atmosphere was more hostile than it had ever been. Kyle's supporters were openly questioning Natalie's legitimacy, while her few remaining allies were feeling increasingly isolated and defensive. The collaborative spirit that had characterized the early days of training had been replaced by factionalism and suspicion. "I think we need to file a formal complaint," Kyle announced to his gathered supporters. "If she's got some kind of undisclosed background or special training, it's creating an unfair evaluation environment for the rest of us." Sarah Peterson nodded enthusiastically. "I agree. We're being held to standards that assume everyone started from the same baseline, but clearly that's not the case." Even some candidates who had previously remained neutral were beginning to align with Kyle's position. Jake Morrison, who had initially been impressed by Natalie's performance, was now questioning whether her success was legitimate. "I mean, it's pretty obvious that she's got experience or training that goes beyond what the rest of us have received. Whether that's fair or not is a valid question." The only strong voice of dissent came from Amanda Chun, who had consistently defended Natalie throughout the program. "You're all making assumptions based on jealousy and resentment," she said firmly. "Just because someone performs better than you doesn't mean they're cheating or have some unfair advantage." But Amanda's support was feeling increasingly hollow, even to her. She had her own questions about Natalie's background, and while she wasn't willing to join the chorus of complaints, she was finding it harder to dismiss the concerns entirely. Natalie, meanwhile, had withdrawn from the social dynamics of the barracks entirely. She spent her evenings reviewing training materials, maintaining her equipment, and avoiding the conversations that inevitably turned to speculation about her background. The isolation was painful, but she'd learned that engaging with the accusations only made the situation worse. The truth was that Kyle and his supporters weren't entirely wrong. Natalie did have experience and training that went beyond what her official record indicated. But that experience came with classification levels and disclosure restrictions that made explanation impossible. She was caught in the impossible position of being unable to defend herself without revealing information that could have serious consequences for national security. As the third week of training drew to a close, the conflict had escalated to the point where it was affecting the entire program. Candidates were choosing sides. Instructors were having to manage interpersonal conflicts in addition to teaching medical procedures, and the overall effectiveness of the training was being compromised by the ongoing controversy. Something would have to give, and soon. The tension had reached a breaking point that couldn't be sustained without seriously damaging the program and the careers of everyone involved. But resolution would require truth, and truth was the one thing that Natalie couldn't provide, at least not without consequences that went far beyond a simple training exercise. The stage was set for a confrontation that would force all the hidden issues into the open, whether anyone was prepared for the revelation or not. The fourth week of training began with an announcement that sent ripples of anxiety through the already fractured group of candidates. Lieutenant Colonel Marcus Blackwood, the commanding officer of the entire combat medical training facility, would be conducting a comprehensive program review. This wasn't routine oversight, it was a formal evaluation, triggered by concerns about program effectiveness and candidate performance disparities. The news hit the barracks like a physical blow. Everyone understood that formal reviews typically resulted in significant changes, and those changes rarely favored the individuals who had caused the problems in the first place. For Natalie, it meant that the speculation and accusations that had been building for weeks were about to be subjected to official scrutiny. For her critics, it represented an opportunity to have their concerns validated by senior leadership. Kyle Henderson wasted no time in organizing what amounted to a coordinated campaign against Natalie's continued participation in the program. He spent the evening before the review meeting with supporters, preparing a formal presentation that outlined their concerns about fairness, evaluation standards, and the possibility that undisclosed factors were creating an uneven playing field. "This isn't personal," Kyle insisted to the gathered group, though his tone suggested otherwise. "It's about program integrity. If Rodriguez has some kind of background or training that gives her an unfair advantage, then our evaluations aren't meaningful. We're being measured against standards that assume equal starting points, but clearly that assumption is false." Sarah Peterson had prepared a detailed analysis of performance metrics that highlighted the gap between Natalie's achievements and those of other candidates. "Look at these numbers," she said, spreading charts across Kyle's bunk. "Her success rates in trauma scenarios are literally off the charts. Her technique scores are perfect or near perfect in every category. Her leadership evaluations are higher than people with years more military experience." Jake Morrison, who had been wavering in his position, seemed convinced by the presentation. "I hate to say it, but the data is pretty compelling. Either she's the most naturally gifted medic in military history, or there's something we don't know about her background." Even some candidates who had remained neutral were beginning to align with Kyle's position. The accumulated evidence of Natalie's exceptional performance, combined with her inability or unwillingness to explain it, was creating a situation where doubt seemed more reasonable than acceptance. Amanda Shun made one last attempt to defend her friend and roommate. "You're all ignoring the possibility that she's just exceptionally talented. Some people are naturally gifted at what they do. Maybe instead of trying to tear her down, you should be trying to learn from her." But Amanda's support was feeling increasingly hollow, even to herself. She'd spent weeks rooming with Natalie, and she'd observed things that didn't quite add up. The way Natalie sometimes woke up from nightmares she wouldn't discuss. The careful way she avoided certain topics in conversation. The occasional slips where she demonstrated knowledge that seemed to come from somewhere other than standard military training. "Amanda," Kyle said, his voice taking on a more serious tone, "I know you want to be loyal, but you've got to see that something doesn't add up here. We're not asking for her to be kicked out of the program. We're just asking for transparency about what we're dealing with." The formal review began at 0800 hours in the main conference room of the training facility. Lieutenant Colonel Blackwood was an imposing figure whose reputation for thorough, no-nonsense evaluations preceded him. He was flanked by Captain Walsh, Master Sergeant Rodriguez, and a staff psychologist named Dr. Rebecca Stone, who specialized in military training programs. The candidates were called in individually for private interviews, and the process began with those who had requested the review. Kyle Henderson presented his concerns with military precision, outlining the performance disparities and questioning whether the program's evaluation standards were being applied fairly. "Sir, I want to emphasize that this isn't about personal animosity," Kyle said, his posture rigid with nervous energy. "Private Rodriguez is clearly competent, and I respect her dedication to the program. But her performance levels suggest experience or training that goes beyond what the rest of us have received, and that creates fairness issues for evaluation purposes." Lieutenant Colonel Blackwood listened without interruption, taking notes and asking occasional clarifying questions. His expression remained neutral, but his questions were pointed and suggested he was taking the concerns seriously. "Henderson, you've outlined performance disparities. Do you have specific evidence of policy violations or undisclosed background information?" Kyle hesitated. "No, sir, not direct evidence. But the circumstantial evidence is compelling. Her technique, her decision-making under pressure, her knowledge of advanced procedures, it all suggests someone with significantly more experience than her official record indicates." The interview continued for 20 minutes, with Kyle presenting his case as thoroughly as possible while trying to maintain the appearance of objectivity. When he was dismissed, he felt confident that he'd articulated the concerns effectively and that the review board would investigate further. Sarah Peterson's interview followed similar lines. With her presenting the statistical analysis she'd prepared, Dr. Stone seemed particularly interested in the psychological aspects of the situation, how the performance disparities were affecting group dynamics and overall program effectiveness. The impact on morale has been significant, Sarah explained. When one person consistently outperforms everyone else by such wide margins, it creates questions about whether we're all being held to the same standards. Some candidates are losing confidence in their own abilities, while others are becoming resentful. Jake Morrison's interview was more conflicted. He expressed similar concerns about fairness, but seemed uncomfortable with the adversarial nature of the process. "I don't want to cause problems for Rodriguez," he said. "She's never been anything but professional and helpful. But I do think there are legitimate questions about the evaluation process." When Amanda Chun's turn came, she found herself in the difficult position of defending someone she had her own doubts about. Her loyalty to Natalie was genuine, but she couldn't ignore the evidence that her roommate was somehow different from the other candidates. "Ma'am, I think Private Rodriguez is being subjected to unfair scrutiny because of her exceptional performance," Amanda told Dr. Stone. "Yes, she's better than the rest of us, but that doesn't automatically mean there's something inappropriate going on. Some people are just naturally gifted." But when Dr. Stone pressed for specifics about Natalie's background and behavior, Amanda found herself admitting details that she hadn't consciously noticed before. The nightmares, the careful way Natalie avoided discussing her previous assignments, the occasional demonstrations of knowledge that seemed to come from somewhere other than standard training. "I'm not saying there's anything wrong," Amanda concluded, "but I understand why people have questions." Finally, it was Natalie's turn. She entered the conference room with the same calm composure she'd maintained throughout the training program, but the stress was beginning to show around the edges. Dark circles under her eyes suggested sleepless nights, and there was a tension in her posture that hadn't been there during the early weeks of training. Lieutenant Colonel Blackwood studied her for a long moment before speaking. "Rodriguez, you're aware that concerns have been raised about your performance in this program?" "Yes, sir. Specifically, questions about whether your background includes experience or training that isn't reflected in your official personnel file." Natalie took a deep breath. This was the moment she'd been dreading since the program began. The point where vague suspicions crystallized into direct questions that demanded specific answers. "Sir, my personnel file accurately reflects my official military assignments and training." It was true, as far as it went. But Lieutenant Colonel Blackwood had been in the military long enough to recognize the difference between complete truth and technically accurate statements. "Rodriguez, I've reviewed your file extensively. Your assignments have been routine medical facilities with no combat deployments. Your training record shows standard progression through medical specialties. But your performance in this program suggests someone with significantly more experience than that background would provide." The room was silent except for the scratching of Dr. Stone's pen as she took notes. Captain Walsh and Master Sergeant Rodriguez watched Natalie carefully, looking for any sign that she was about to reveal information that would explain the mystery. "Sir, I've tried to make the most of every training opportunity throughout my career," Natalie said carefully. "I've studied extensively and observed experienced medical personnel whenever possible." Lieutenant Colonel Blackwood leaned forward. "Rodriguez, I'm going to be direct with you. Your performance in advanced trauma scenarios, your knowledge of field expedient techniques, your ability to function under extreme stress, these things don't develop from observation and study alone. They come from practical experience." He paused, his eyes never leaving her face. "I need you to tell me if there are aspects of your background that aren't reflected in your standard personnel file. This isn't about getting you in trouble. It's about understanding what we're dealing with and ensuring fair evaluation standards for all candidates." Natalie felt the weight of the moment pressing down on her. She could continue with vague deflections and technically accurate non-answers. But it was clear that Lieutenant Colonel Blackwood wasn't going to accept that approach. The review board was demanding transparency, and her fellow candidates deserved to understand what they were competing against. But the truth was complicated in ways that went far beyond simple training program politics. Her actual background included elements that were classified at levels that made casual discussion impossible. Revealing the full truth could have consequences that extended far beyond her individual career. "Sir," she said finally, "there are aspects of my service that involve classification levels that prevent detailed discussion." It was the first direct acknowledgement that there was more to her story than her official record suggested. "Lieutenant." Colonel Blackwood exchanged glances with the other members of the review board, and Dr. Stone made additional notes. "Rodriguez, are you saying that you have undisclosed military experience that would explain your exceptional performance?" The question hung in the air like a physical presence. Everyone in the room understood that her answer would determine not just her continued participation in the program, but potentially the careers and futures of multiple people. Natalie looked directly at Lieutenant Colonel Blackwood. "Sir, I'm saying that my complete service record includes elements that are classified above the level of this discussion." Captain Walsh leaned forward. "Rodriguez, if you have classified experience that's relevant to your performance in this program, we need to understand the scope and nature of that experience. The other candidates have legitimate concerns about evaluation fairness." "Ma'am, I understand their concerns, and I respect their right to raise them. But I'm not authorized to discuss certain aspects of my background without proper clearance. Verification and need-to-know determination." The formal language was significant. Natalie wasn't just claiming that she had classified experience. She was using the specific terminology that indicated familiarity with high-level security protocols. It suggested that whatever she was hiding was more substantial than additional. Training or temporary assignments. Lieutenant Colonel Blackwood sat back in his chair, processing the implications of what he'd just heard. If Natalie was telling the truth about classified background, it would explain her exceptional performance while also creating serious complications for the training program. If she was using classification claims to avoid accountability, it was a serious breach of military ethics that would result in immediate dismissal from the program. "Rodriguez, I'm going to need to verify your classification claims through appropriate channels. That process may take several days, during which time your participation in the program will be suspended pending resolution of these issues." The words hit Natalie like a physical blow. Suspension from the program meant that weeks of exceptional performance would be meaningless if the classification verification didn't resolve in her favor. It also meant that her fellow candidates would interpret the suspension as confirmation that their suspicions were justified. "Sir, I understand the necessity of verification, but I request that my suspension be kept confidential until the process is complete." "That's not possible, Rodriguez. The other candidates have raised legitimate concerns, and they deserve to know that those concerns are being taken seriously. Your suspension will be announced to the group this afternoon." As Natalie left the conference room, she felt the weight of impending disaster settling around her. The careful balance she'd maintained for weeks, performing excellently while avoiding detailed scrutiny of her background, had finally collapsed. Now everything depended on whether the classification verification process would resolve in her favor, and whether the revealed truth would be something her fellow candidates could accept. The announcement of her suspension sent shockwaves through the barracks. Kyle and his supporters saw it as vindication of their concerns and evidence that their accusations had been justified. Amanda Chen felt betrayed and confused, realizing that her defense of Natalie had been based on incomplete information. The candidates who had remained neutral felt foolish for not recognizing the signs that something was amiss. "I knew there was something she wasn't telling us," Sarah Peterson said, her voice carrying a mixture of satisfaction and disappointment. You don't get suspended from a program like this unless there are serious issues. Kyle was more direct in his assessment. She's been lying to us from day one. All that talk about studying extensively and making the most of training opportunities, it was all bullshit designed to cover up whatever she was really hiding. Even Jake Morrison, who had tried to remain diplomatic throughout the controversy, seemed convinced that Natalie's suspension validated the concerns that had been raised. I feel bad for her, but you can't blame us for asking questions when someone's performance is that far outside normal parameters. Amanda Chun found herself completely isolated in her continued support for Natalie. We don't know what the classification verification will show, she argued. Maybe she does have legitimate experience that explains her performance. Maybe the suspension is just a procedural requirement. But Amanda's words sounded hollow even to herself. The fact that Natalie had been suspended rather than having her background quickly verified suggested that the issues were more complex than simple classification levels. It implied that there were serious questions about her eligibility for the program, or the accuracy of her previous statements. The atmosphere in the barracks that evening was unlike anything that had existed during the previous weeks. The uncertainty and suspicion that had been building was replaced by a sense of vindication among Natalie's critics and confusion among everyone else. The woman who had been setting the standard for excellence was suddenly absent, and her absence felt like confirmation that their doubts had been justified. But mixed with the vindication was an uncomfortable recognition that Natalie's suspension left a significant gap in the program's dynamics. Her exceptional performance had pushed everyone to achieve higher standards, and her absence was immediately noticeable in the reduced intensity and effectiveness of training exercises. More troubling was the realization that if Natalie's background included legitimate classified experience, then her critics had spent weeks undermining someone who had every right to be in the program. The possibility that they had been wrong about her motivations and honesty created its own form of anxiety about what the verification process might reveal. As the candidates settled into an uneasy sleep that night, everyone understood that the next few days would determine not just Natalie's future in the program, but the resolution of weeks of accumulated tension and suspicion. The truth, whatever it turned out to be, would finally be revealed, and that truth would change everything they thought they knew about the quiet woman who had been dominating their training program with skills that seemed to come from nowhere and everywhere at once. The verification process took exactly 72 hours, though each of those hours felt like an eternity to everyone involved. Natalie spent the time in administrative limbo, confined to quarters while her future hung in the balance of classified communications between Lieutenant Colonel Blackwood and undisclosed offices in Washington. The other candidates continued their training, but the atmosphere was heavy with anticipation and uncertainty about what the investigation would reveal. On Thursday morning, at precisely 0900 hours, Lieutenant Colonel Blackwood received the final clearance authorization he'd been waiting for. The document that arrived via secure military communication was brief but decisive. Authorization to access and discuss previously classified elements of Private Natalie Rodriguez's service record, with specific permission to share relevant details with training personnel and affected candidates. What he read in the following 30 minutes transformed his understanding of everything that had transpired over the previous month. The secure file that arrived contained service records that existed parallel to Natalie's official personnel documents, but at classification levels that prevented their inclusion in standard military databases. Her actual service history included assignments, training, and operational experience that painted a completely different picture of who she was and where her exceptional abilities had originated. Private First Class Natalie Rodriguez had been recruited directly from her advanced individual training by the Army's Special Operations Medical Training Command for participation in a pilot program that prepared medics for attachment to elite special operations units. The program, classified under the code name Guardian Angel, was designed to create medical personnel capable of providing advanced trauma care in the most dangerous and isolated combat environments. The selection process had been extraordinarily rigorous. Out of nearly 500 candidates initially screened, only 12 had been accepted into the program. The training itself had lasted 8 months and covered advanced surgical techniques, combat medicine in austere environments, chemical and biological warfare medical countermeasures, and operational medicine for deep reconnaissance missions. But the training was only the beginning. Upon graduation from Guardian Angel, Natalie had been assigned to operational support for Task Force Mercury, a joint special operations unit conducting classified missions in multiple theaters. Her official personnel record showed routine assignments to stateside medical facilities, but the classified record revealed 18 months of deployment with Mercury, including direct participation in 47 combat operations. Lieutenant Colonel Blackwood paused in his reading to process the implications of what he was learning. Task Force Mercury was legendary within special operations circles, known for conducting the most dangerous and sensitive missions that conventional forces couldn't handle. The medical personnel attached to Mercury weren't traditional combat medics. They were essentially special operations soldiers who happened to specialize in keeping other special operations soldiers alive under impossible circumstances. Classified record detailed Natalie's specific contributions during her time with Mercury: 17 successful trauma surgeries performed under combat conditions, 32 casualties evacuated from hostile territory, and leadership of medical operations during 3 separate missions, where she was the senior medical authority for teams operating without conventional support. But it was the final entry in her classified record that explained why she was no longer with Task Force Mercury, and why she was pursuing additional training through conventional medical programs. During her last operational deployment, a mission designated as Operation Nightfall, Natalie's unit had been tasked with extracting a high-value intelligence asset from deep within enemy territory. The mission had gone wrong in ways that were both predictable and catastrophic. Intelligence failures had resulted in the team walking into a carefully prepared ambush, and what should have been a routine extraction had turned into a desperate fighting withdrawal across 30 miles of hostile territory. Of the 12-person team that had gone in, only 7 had made it to the extraction point alive. Natalie had been responsible for keeping 3 critically wounded team members alive during the withdrawal, performing battlefield surgery while under direct fire and coordinating medical care while the team moved through enemy territory. Her actions had saved lives, but the psychological cost had been significant. The classified record included a psychological evaluation that recommended temporary reassignment to non-operational duties while she processed the trauma of losing 5 teammates. Lieutenant Colonel Blackwood closed the file and sat back in his chair, absorbing the magnitude of what he'd learned. The woman who had been suspended from his training program wasn't just an exceptionally gifted medic. She was a decorated special operations veteran whose combat experience exceeded that of most of his instructors. Her exceptional performance wasn't the result of undisclosed advantages or unfair preparation. It was the natural result of someone whose previous service had included challenges that made the current training program seem routine by comparison. At 1,400 hours, all candidates were assembled in the main briefing room for what they assumed would be an announcement about Natalie's status in the program. Kyle Henderson and his supporters expected confirmation that their concerns had been validated and that Natalie would be dismissed from the program for undisclosed background issues. Amanda Chun hoped for vindication of her continued support, but she wasn't optimistic about the outcome. Lieutenant Colonel Blackwood entered the room with Captain Walsh and Master Sergeant Rodriguez, their expressions serious but unreadable. The candidates sat in rigid attention, understanding that whatever they were about to hear would determine the resolution of weeks of accumulated tension. Ladies and gentlemen, Lieutenant Colonel Blackwood began. The classification verification process regarding Private Rodriguez is complete. I'm authorized to share relevant information that will resolve the questions that have been raised about her performance in this program. He paused, scanning the assembled faces. Private Rodriguez's exceptional performance is the direct result of previous military service that includes specialized training and operational experience at classification levels that prevented earlier disclosure. Kyle Henderson felt his stomach drop. The formal language suggested that Natalie's claims about classified background were legitimate, which meant that his accusations had been based on incorrect assumptions. Private Rodriguez is a graduate of the Army's Guardian Angel program, a classified special operations medical training initiative. Following her graduation, she served 18 months with Task Force Mercury, providing medical support for special operations missions in multiple combat theaters. The room was completely silent. Most of the candidates had never heard of Guardian Angel, but everyone understood the significance of Task Force Mercury. It was one of the most elite units in the military, and medical personnel assigned to Mercury were considered among the best in their field. Lieutenant Colonel Blackwood continued. During her operational service, Private Rodriguez participated in 47 combat missions, performed 17 trauma surgeries under combat conditions, and led medical operations for deep reconnaissance teams operating without conventional support. Her medical experience exceeds that of most military medical personnel, including many of our instructors. Sarah Peterson felt like she was going to be sick. The statistical analysis she'd prepared comparing Natalie's performance to other candidates suddenly looked completely different when viewed against the backdrop of special operations experience. Private Rodriguez requested that her special operations background not be disclosed unless necessary, because she wanted to be evaluated based on current performance rather than past achievements. Classification requirements prevented her from explaining her exceptional abilities when questions were raised about their origin. Jake Morrison was staring at the floor, realizing that his support for the complaints against Natalie had been based on fundamental misunderstandings about who she was and what she represented. The concerns raised about evaluation fairness were legitimate based on the information available to you, Lieutenant Colonel Blackwood acknowledged. However, those concerns were based on incomplete information about Private Rodriguez's actual background and qualifications. At this moment, Lieutenant Colonel Blackwood made a decision that would transform the entire dynamic of the situation. Private Rodriguez, please step forward. The candidates turned in their seats as Natalie entered the briefing room. She was wearing her standard training uniform, but something about her bearing had changed. The careful invisibility she'd maintained for weeks was gone, replaced by the quiet confidence of someone who no longer had to hide who she was. Private Rodriguez, Lieutenant Colonel Blackwood continued, you've been subjected to weeks of suspicion and accusations because classification requirements prevented you from explaining your background. I'm now authorized to ask you to share your experiences with your fellow candidates so they can understand what they've been dealing with. Natalie stood at attention, but her voice was calm and steady as she began to speak. My name is Natalie Rodriguez, and I'm a graduate of the Guardian Angel Special Operations Medical Program. For the past 80 months, I served with Task Force Mercury, providing medical support for classified operations in hostile territory. The weight of her words settled over the room like a physical presence. Kyle Henderson, who had been leading the campaign against her, looked like he wanted to disappear. During my time with Mercury, I participated in 47 combat operations. I performed emergency surgery on 17 occasions while under direct fire. I led medical evacuation operations where conventional support wasn't available. I've treated casualties with injuries that most medical personnel never encounter. And I've made decisions about who lives and who dies when resources were insufficient to save everyone. Her voice remained steady, but there was an undertone of something deeper. the weight of experiences that had shaped her in ways that went beyond medical technique. My last operational deployment was Operation Nightfall, where we were tasked with extracting a high-value intelligence asset from deep within enemy territory. The mission went wrong. Of the 12-person team that went in, only 7 came out alive. I was responsible for keeping 3 critically wounded teammates alive during a 30-mile fighting withdrawal while under constant enemy contact. The silence in the room was profound. These young soldiers who had been questioning Natalie's legitimacy were learning about experiences that exceeded anything in their own military careers. I saved the lives of my 3 teammates, but I lost 5 others. The psychological evaluation that led to my reassignment recommended temporary removal from operational duties while I processed the trauma of losing people I'd served with for months. She paused, looking directly at Kyle Henderson. When I requested an assignment to this training program, I asked that my special operations background not be disclosed. I wanted to be evaluated based on current performance, not past achievements. I wanted to learn alongside other soldiers without the expectations and assumptions that special operations experience creates. Kyle Henderson stood up slowly, his face pale with the recognition of what he'd done. "Ma'am, I don't know how to apologize for what I've put you through. I organized a systematic campaign against someone whose service record makes mine look like basic training." Natalie looked at him steadily. "Henderson, you raised legitimate concerns based on the information available to you. The problem wasn't your questions, it was my inability to answer them honestly because of classification restrictions." But Kyle wasn't finished. "No, ma'am, that's not acceptable. I should have trusted that there was a reasonable explanation for your performance instead of assuming you were somehow cheating or gaming the system. I let my own insecurities drive me to attack someone whose service to this country exceeds anything I've accomplished." Sarah Peterson stood up next. "Ma'am, I prepared statistical analyses designed to prove that your performance was somehow illegitimate. I was so focused on the numbers that I never considered that exceptional performance might be the result of exceptional experience." One by one, other candidates stood up to acknowledge their role in the weeks of suspicion and hostility that Natalie had endured. Jake Morrison, who had supported the complaints despite his better instincts. David Williams, who had remained silent when he should have defended her. Even candidates who had never spoken against her directly acknowledged their failure to support her when she was being unfairly attacked. Amanda Chun was the last to stand. "Natalie, I tried to defend you, but I realize now that my defense was based on friendship rather than understanding. I should have demanded that people treat you with respect regardless of explanations for your performance." Lieutenant Colonel Blackwood watched the proceedings with a mixture of professional satisfaction and personal reflection. The situation had evolved into something more significant than resolving questions about one candidate's background. It had become a lesson in leadership, judgment, and the dangers of making assumptions about people based on incomplete information. "Private Rodriguez," he said, "your performance in this program has been exceptional. But more importantly, your conduct during weeks of unfair scrutiny has demonstrated the kind of character that the military needs in its medical personnel. You've shown that true strength isn't about proving your capabilities to others. It's about maintaining your integrity when others question those capabilities." He turned to address the entire group. "All of you have learned important lessons about the dangers of assumption and the importance of trust within military units." Private Rodriguez could have ended this situation at any time by revealing her background, but she chose to endure suspicion and isolation rather than use her past achievements to silence critics. Master Sergeant Rodriguez stepped forward. "I want to add something to what the colonel has said. Private Rodriguez's performance during this training hasn't just been exceptional, it's been restrained. Based on what I now know about her background, she's been operating well below her actual capabilities in order to fit in with the group, and avoid drawing attention to herself. Captain Walsh nodded in agreement. What we've witnessed over the past month isn't someone showing off or trying to dominate the program. It's someone with extraordinary capabilities trying to be a normal member of the team while maintaining the highest standards of performance. The transformation in the room's atmosphere was remarkable. The suspicion and resentment that had characterized the previous weeks was replaced by something approaching awe and respect. But more than that, there was a recognition among the candidates that they had been privileged to train alongside someone whose experience and abilities exceeded most military medical personnel. Kyle Henderson approached Natalie as the formal briefing concluded. "Ma'am, I know that an apology can't undo weeks of unfair treatment, but I want you to know that I've learned something important about leadership and judgment from this experience." Natalie extended her hand to him. "Henderson, the military is about learning from experiences and becoming better soldiers. What matters now is how we move forward as a team." Over the following hours, similar conversations took place throughout the barracks as candidates processed the magnitude of what they'd learned. The woman they'd been questioning and undermining was someone whose service record exceeded their collective experience, and whose conduct during the controversy had demonstrated exactly the kind of character the military sought to develop in its personnel. Sarah Peterson spent the evening reviewing her statistical analysis with new understanding. Natalie's performance hadn't been anomalous. It had been the predictable result of someone whose previous service included medical challenges. That made the current training seem routine. Jake Morrison was struggling with guilt about his support for the complaints against Natalie, but he was also processing important lessons about the difference between legitimate concerns and assumptions based on incomplete information. Amanda Shun felt vindicated in her loyalty, but she also realized that true friendship meant supporting someone even when you didn't understand their circumstances. The program continued for 2 more weeks, but the dynamics were completely transformed. Natalie's revealed background changed how everyone approached training, but more importantly, it changed how they approached each other. The lesson that exceptional performance might have exceptional explanations became a fundamental principle that would serve them throughout their military careers. During the graduation ceremony, Lieutenant Colonel Blackwood delivered remarks that emphasized the broader lessons of the experience. "You've learned advanced medical techniques and combat procedures, but more importantly, you've learned about trust, judgment, and the importance of supporting your teammates even when you don't fully understand their circumstances." He looked directly at Natalie as he continued. "Private Rodriguez has demonstrated that true excellence isn't about proving your capabilities to others. It's about maintaining your standards and integrity regardless of external recognition or understanding." Kyle Henderson was selected as the honor graduate based on his overall performance and his demonstrated growth in leadership and judgment. But in his acceptance speech, he made it clear who the real example was for their class. "I learned more about leadership and character from Private Rodriguez than from any manual or instructor," he said. "She showed us that strength isn't about dominating others or proving your superiority. It's about maintaining your integrity and continuing to serve even when others question your right to be there." As the ceremony concluded and the candidates prepared for their next assignments, Natalie reflected on the experience with mixed emotions. The weeks of suspicion and isolation had been painful, but they had also reinforced important lessons about service, humility, and the value of earning respect through actions rather than credentials. More importantly, she'd learned that her desire to be anonymous and unremarkable wasn't always possible or even desirable. Sometimes leadership meant accepting recognition and using your experience to elevate others, even when personal preference was to remain in the background. The Combat Medical Training School class graduated with exceptional ratings across all evaluation categories, but their real achievement was the lesson they'd learned about judgment, assumption, and the importance of understanding that everyone has a story that isn't immediately visible. Natalie Rodriguez had entered the program hoping to be just another candidate, but she left it having demonstrated that true strength comes from maintaining your integrity when others question your worth. Her tattoo remained hidden beneath her uniform, but her character had been revealed in ways that would influence her teammates for the rest of their careers. The story of the quiet soldier who outperformed everyone while enduring weeks of unfair scrutiny became part of the training school's institutional memory, a reminder that excellence often comes from unexpected sources, and that the strongest people are often those who choose to serve quietly without seeking recognition for their sacrifices. Most importantly, it served as proof that before judging someone's abilities or questioning their right to be somewhere, it's worth remembering that you never know the full story of the person standing beside you. The administrative coordinator might be a former special operations warrior. The quiet teammate might be someone who once stood alone against impossible odds. And the person who seems out of place might be exactly where they belong. Natalie Rodriguez continued her service with the same quiet dedication she'd always shown, but with the understanding that sometimes the greatest service comes not from hiding your light, but from using it to help others find their way in the darkness. Up next, you've got two more standout stories right on your screen. If this one hits the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.